For the first time in years, COVID isn't the virus dominating conversations among doctors. Right now, they're more worried about RSV.
Right, it's not new, but it spreads easily and it impacts mostly children, and it's causing problems nationwide.
For the next 15 minutes, we're going to dig into how hospitals are getting ready in the triad, the threat of a triple-demic, and how parents can keep their kids safe.
All right, so we're going to begin with the newest troubling trend across the country. The CDC says cases of RSV have doubled in half of the U.S. states in the past month. North Carolina is one of them. Atrium Health Wake Forest Baptist could not provide specific numbers, but officials did say they've seen a substantial increase in cases. They told us they typically don't see this many cases this early in the virus season. Now that has led to more and more kids showing up in their hospitals. We did get numbers in from Cone Health. Let's take a look at how it's grown in the past 3 years. Compared this week from 2020 to now. 2 years ago, they didn't see many sick kids with RSV. This year, it's all the way up to 72. Keep in mind that number is only cases confirmed by testing. The actual number could be higher.
It almost feels like, here we go again. Another virus spreading uncontrollably, threatening our healthcare systems. The good news is hospitals say they took lessons from the pandemic. Novant Health said in this statement, while we were concerned these increases could impact our bed capacity, Novant Health has extensive surge planning in place and stands ready to activate as needed. It's important for our communities to know we have the continued ability to care for them and that they should seek care when they need it. Hospitals nationwide are saying the same thing.
We have been planning for this for the last couple of years and are having constant meetings about how we can best utilize our space and our staff to make sure that every child who needs our care we're able to care for. And frankly, as we move forward, every option will be on the table if it's necessary.
RSV is so common that almost all children get it by the time that they turn 2. Despite this, the American Lung Association doesn't think enough parents fully understand the risks associated with the virus. So they've launched a campaign to help teach them. The big takeaway, don't wait to call your doctor.
This is the time to talk to your pediatrician, head to the emergency department. Anyone is at risk.
The Lopez family dealt with severe RSV in the summer of 2021.
Just told me B2. Patients at higher risk for severe illness from RSV include premature infants, children under 2 with lung disease or congenital heart disease, and kids with weakened immune systems. Now, this family's child had a severe case of the virus last year. The boy's mother says they tried everything to keep their infant from getting sick.
Be an advocate for your kids. If you think something's wrong, don't be afraid to call the pediatrician.
She says parents know their children and they should just be trusting their instincts. We also wanted to make sure that you know everything you can about RSV, so our Verify team is here to provide you a cheat sheet of the version of the virus.
We're staying on top of this story, and that means not just tracking the numbers or health alerts, but finding out what you need to know in your own home about this virus. So we turn to several sources to verify. What is RSV? Short for respiratory syncytial virus. The CDC lists RSV symptoms of runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing, typically appearing in stages rather than all at once. Dr. Ruth Cantula, MedStar pediatrician, says it's often hard to tell the difference between RSV and other common viruses, but it's very easy to transmit, spread through droplets of coughs and sneezes in the air or on infected surfaces where the virus can live for hours, or through direct contact. There's no vaccine to prevent it, and you can get it more than once at any age.
The most vulnerable populations are children who are less than 2 years old.
Our experts say babies are more prone to lower respiratory tract infections, plus inflammation of the airways or lungs from RSV, and can't naturally compensate for breathing issues like older kids and adults.
So if I can't breathe through my nose, I know I can breathe through my mouth. Babies don't know that necessarily.
RSV symptoms also tend to be more severe in adults age 65 and older. How is RSV treated? Most cases go away in a week or so, says the CDC, which recommends managing symptoms with over-the-counter meds and drinking plenty of fluids. RSV most often requires hospitalization because of dehydration or difficulty breathing. In babies, Dr. Cantula says poor feeding or irritability could also be signs they need more oxygen.
If you notice that your child's symptoms are lasting for a longer period than would be expected, that would be a reason to take your child in to have them evaluated by the pediatrician.
Avoid spreading RSV. Wash your hands, cover your mouth, keep your distance, and stay home when you're sick. Those back to basics health tips that are so good at preventing common seasonal bugs work here too. And that's important because some, adults especially, could have RSV and not even know it. With your Verify, I'm Abby Larico.
So one big problem with some RSV cases is that people can't seem to stop coughing. Fortunately, there's an easy, pretty cheap remedy that most people already have at home. The Mayo Clinic tried treating young children with 2 teaspoons of honey. This is right before they went to bed. They found the honey helped kids stop coughing and get a better night's sleep. The study also found the honey actually appeared as effective as most over-the-counter cough medicines for kids. But, and this is really important, doctors say you should never give it to a child younger than 1 year old.